Hi, my name's Olivia. I'm going to be doing a peer response view for Tyler Austin's thorax and lungs and cardiovascular assessment. Um, Overall, really great job, Tyler. You did a fine job of explaining what you were doing before you did it, making sure that the patient was in tune with what you were going to do. I would say maybe a little bit more in depth with like the subjective questions, because some people may not think that things like coughing or chest pain or drug history has anything to do with like the lungs or cardiovascular system, so maybe just be a little bit more in depth. I will say nice job remembering the temporal pulse and only doing the carotids on one side at a time. Good job. Maybe move the camera a little bit lower so we can see her legs when you assess like the popliteal and the dorsalis pedis pulses. But for the carotids, I do want to let you know, have her breathe in and then breathe out, and on that exhale, hold. I noted that you used really nice terminology in reference to the heart, doing like the right sternal border, left sternal border. Maybe when I will note that when you were listening to her mitral valve at the fifth intercostal space midclavicular, that you maybe go down a little bit further. It might have just been a bad angle with the camera, but I don't know if you were down far enough for that. And then I guess I do have a couple questions. So where would you listen to the lungs on the sides? Like what would be the intercostal space numbers? And then on percussion, what sounds should you hear? You mentioned dull, but it should only be dull over visceral tissue or like liver tissue. There should be a different sound that you hear when percussing during on the upper lungs. And then what muscle are you moving to check like the brachial pulse? I know you said it was really easy to find on her, but it's kind of like a good assessment technique to say what muscle you're going to move. Sometimes you have to push it up against that muscle, that tendon that's right there. But that's it. But overall, good job.